doing enough to take control. We've already seen Europe go through this very pronounced second wave. They have achieved control. It's being much more aggressive. And what's also important to note is that this is the worst of times yet in the pandemic for the US, but we're not that far away from getting the vaccines out there. Having now approved monoclonal antibodies, rapid tests at home for the first time being approved. So although the fatigue is setting, we're just not doing enough to be the bridge to a much more favorable outlook.
Yeah, I like the way you talk about it. We just, like, the country just needs a bridge to get to that vaccine. Just a bridge. It's like, just hold on a bit longer. The positivity rates, I know, is something that you've been talking about. The numbers in some states are just bonkers. I mean, 50% positivity, 70% positivity. What does this say about where we're headed? Why does this bother you so much?
Well, to see Wyoming over 70%, Kate, I've never seen anything like this in the entire world of positivity of tests. But throughout the Dakotas and the neighboring states, we're seeing 50+%. And it just shows that we're not doing enough testing. We're not taking this seriously. It's almost like being numb and paralyzed when it should be just the opposite, doing everything we can, full court press. And it's amazing to see in this country that we can't get the tests going where we need them the most.
Yeah, so you mentioned the Dakotas. We just heard from South Dakota's Governor Kristi Noem and Natasha's story. She's defending her position on not mandating masks and not locking down her state more or restricting her state more. She's saying because those two things that she could do is not the reason cases are so high in her state. What do you think of that?
It's reprehensible. And the reason you can say that is, for one, the Dakotas are the top two per capita in cases and deaths in the world. And we know the things that would help, like masks, and she's in total denial, saying that she won't do a mask mandate, and the little bit that she has done to support masks is just inadequate. So this is just reckless, and it's somewhat emblematic of several parts of the country that just not doing the things that we know would help.
And you mentioned numbness. This one thing you have been hitting on is this numbness that has set in. The president has disappeared. 12 of the last 16 days, he's had nothing on his schedule, and he's definitely not focusing on COVID publicly, for sure. We have 80,000 people sick enough with COVID that they need to be in the hospital. Those are numbers that people cannot make up. It doesn't have to be this way, but what does this numbness that we all see in our lives, what is this numbness that we're all seeing in our lives towards this pandemic?
Yeah, it's not a simple matter, unfortunately, because some of it is fueled by misinformation, some of it coming from our own president and administration, and some of it is just the fatigue factor. The kind of sense that of doom that this is just going to happen when it isn't at all the case. We know so many things that don't require a national lockdown that would turn this around. We've seen many successful countries that didn't have to use the most stringent measures and they got control. It's just the lack of leadership here is stunning, really.
What is your assessment of testing right now nationwide? We're seeing long lines waiting for testing in many states at this point. The large labs saying that they're projecting there's going to be big delays in getting results. How are we back to this place still, this many months in, that the system is so stressed it can't handle testing capacity still?
Yeah, that's a really important point because, we are barely over 1 million tests a day. When working with the Rockefeller Foundation Action Plan, we recommended at least 5 to 7 million tests a day, at least. So we've never gotten the testing right. And the turnaround times are also unacceptable still. So what the remedy for this is the home testing. Every household should have a free supply, a significant number of home tests, so they would know whether people are going out to work, to school, to travel, whatever, if they might be infectious. We haven't made that switch. It's our FDA, unfortunately, that is finally starting to come around, but we can never get to the level of testing with the crude methods that we're relying on right now. And so this has been going on, as you say, Kate, for so many months. It's a model that has failed. The testing, we know the answer. It's just that we haven't been able to implement it. The only good thing, though, this week we saw the first rapid home test approved, and that's opening the door for many more, 30, 40 different rapid home tests that could go as low as $1, that you could get the answer within 5 minutes. That's what we really need.
Yeah, we have learned collectively, the collective we have learned a lot, and there is so much progress is being made from the tests to the vaccine. It's just this bridge you're talking about that everyone has to buy in and wrap their arms around each other one more time and just get through it. Doctor, thank you.
Thank you, Kate.
Coming up for us, moments from now, we're going to get